think this fellowship offers people the opportunity to do almost a traveling fellowship within a fellowship. You have a variety of different surgeons that practice in a variety of different ways, and you have the ability to not only observe but participate in these various ways to treat the same problem.
The fellows work directly with faculty and on a daily basis. Their schedules essentially mirror the faculty schedules. So for example, if I'm operating, the fellow will be operating with me. If I'm in clinic, the fellow will be in clinic with me. If I have an administrative day, the fellow will have an administrative day. It mirrors real life. You can see what it takes to juggle the challenges of a medical practice and an academic practice.
What we do from the beginning is, in a very structured way, gradually step back and allow the fellow to take more and more control and have more and more autonomy in the case, so that by the end of the year, they're really ready.
One of the powerful aspects of this orthopedic trauma fellowship is the diversity of education and training amongst the faculty. Each faculty member spent some portion of their training or was able to practice outside of Atrium Health. And what that creates is a very rich and nuanced experience for the fellows, because they're exposed not just to the surgeons here, but to the thoughts and surgical techniques that these surgeons developed or learned from surgeon leaders and educators all over the country.
There is not a Charlotte way or Atrium way or CMC way to do things. All the faculty have different educational backgrounds, and this results in a large variation in their treatment of similar conditions. The fellowship faculty prioritize education and didactics. We have recently revamped the entire educational curriculum.
We also have a business curriculum where we go through some journal articles focusing on practice management, and there's also a series of practice management lectures that the fellows get.
As a fellow, when you come here, you're primarily here at CMC Main. So we operate at the main OR, and then we operate at one-day surgery, which are both basically in this hospital. And then very occasionally, we will go to another hospital, Mercy Hospital, which is about 1.5 miles away, and do cases over there. We have a large breadth of cases here. We have a lot of volume that comes through our trauma center, and we see the worst of everything. And so we're a tertiary/quaternary referral center. We have no shortage of volume, that's for sure.
The fellows are on call 1 out of every 3 weekends, and they work both with a combination of orthopedic trauma attendings and also the non-trauma specialty attendings. And so the 2 weekends that they're off, they get time to spend with their families and do whatever recreation activities they want. There's certainly plenty of that to do around Charlotte.
It really is a family-friendly place.
In the 13 years that I've been here in Charlotte, I've never heard of a fellow or fellow's family who was not happy being in Charlotte.
The food scene is good, the entertainment scene is good, you're safe here, things are affordable here, travel is very, very easy.
It's a young city. There are a lot of younger professionals that live and work here. The weather is nice. There are mountains 2 or 3 hours away. The beach is 2 or 3 hours away. We have mountain biking trails. There's just always something going on in Charlotte. It's just a very lively city.
I think the fellows graduate extremely prepared from this program. I think they're very happy with the amount of academic learning they have, and also with the amount of OR experience they have as well. Once they graduate, they become our colleagues and can call us or text us at any time about cases. We're always happy to provide any guidance that we can.
I don't think you realize in fellowship how prepared you will be at the end of the day. And I think that they did a very good job at preparing for, teaching because you're involved with the residents, preparing for the big cases that come through the door because they do. With all the teaching and everything that goes on throughout the year, they give you a good ability to work through the problems that may come through your door.
Many of our fellows have become leaders in the Orthopedic Trauma Association, the Academy, and the AO. At Carolinas, we have a fantastic group of alumni. Many of them are actively involved in many of the societies that you will want to become a member and be active in.
I was a trauma fellow here several years ago. Things that drew me to this fellowship are, of course, its great reputation, I think for several reasons. One is the intense amount of clinical trauma that you'll actually see that comes into our emergency department. And we also have great collaboration with the other departments and subspecialties within the hospital.
The amount of volume of trauma that I think that we saw during that year as a whole was a memorable experience. And then honestly, just working with each individual attending, not only do they have a long storied experience, but you are with them on a daily basis, really kind of understanding what it is to be a trauma surgeon, talking to the patients, seeing them in the office with the attending, planning the cases with them when they're planning the cases. So you really are living the life of a trauma surgeon, and the mentorship that you get in that sort of modality, I think, is really far superior than what you'll see elsewhere in the country.
CMC is the premier academic orthopedic trauma fellowship in the country. It was billed that way from the very beginning. When you first went on your interview, the expectation is that as a CMC fellow, you're going to go on to being an academic orthopedic traumatologist.
When we're looking at what fellows will do well here, it's fellows who are motivated to learn throughout the year, fellows who want to see as many cases as they can do and really want to get involved in each case individually and also in the trauma service.
I think the most important characteristic was being someone who is easy to work with, a person who is flexible, easygoing, and willing to adapt that is successful in that role.